Hey, this is Dr. Brenda Mondragon. Welcome to my channel. Let's get started. Subscribe. Okay, come back. And then go ahead one more time for me. I'm checking a different region. Yeah, she has a lateral curvature on the side there. Okay, so I'm just gonna feel. So go ahead and, as long as you're okay with that, I'm gonna just see how much this curvature goes. She's got like a lot of pressure right here. This is a huge muscle spasm, not so much on the right. We can see the definition of the scapula better than this because her scapula is rolled this way, and that's the spine taking it this way, okay? Yeah, this is all swollen right here. So we can see there's the scapula is dropped lower here. It's more prominent. This one, as it rolled away, it rolled up. Spasms here, muscle spasms begin here. And I'm gonna have you look up and back for me. Yeah, and then stay there, back, okay. Then right here it changes to the right. Take your chest out this way. Yes, okay, let's cross your arms for me. You're gonna cross them like up like this. You see, just not that much flexibility in her mid-back here, which is common. Very common. Okay, now we're gonna take you this way. Any pain? I'm gonna take you the other way. Easier to go this way. Yeah. Okay. Go ahead and just open the knees for me. And then close, open, and close. The muscle spasm. I'm going to stop here and feel this one on the left. So they have her open up her mouth so that they can get a good picture at this top joint up here. See how this is slid over to the right here. And there's some rotation. There's a lateral component, so she's way open over here on the left. Here's her heart. Left-hand side, that's your marker because well, it also says left and right. But you kind of check and see here's the little fundus of her stomach, and okay, she's got a nice gas bubble in her stomach. Yay! You look whenever you see an X-ray, you make sure that you look at everything. You look at not just what our objective is, which is your spine. Okay, she looks okay here. Clavicles, we're checking if there's any missing. Yeah, and she still has the same high over here, scapula over here, and here's her dropped right side. Okay, that is this up here that I'm feeling for, right there. So on her, it's like right here. So then what I have her do is we say, okay, at this point, go ahead and laterally flex your neck. Does that feel more comfortable, the same, or worse than this side? Is one way easier?
I think this way is easier because it just like falls.
Yes. Okay. And that matches the X-ray because there was a lesser gap over here and there's a wider gap on the left. Okay. So the atlas is sitting this way.
Oh, so it's like it wants to naturally go
just
this way.
Go that way because you're made that way. Okay. Breathe. That's it. a second, it's all under here.
This area felt a little tender.
Yeah, it's just all, so when I find this one, right? Yeah, when I feel when I find something like that, then I go, okay, and I travel it up into the head, and then I'm like, oh no.
I didn't know there was something
Yeah, right into here. I was like, oh, there is a little swelling. Okay. It's my job. It's my job to find them, you know. Look, I can even go into the eye.
Wow.
Look, watch. I can go like into here. And just pull that. You see that, Linnea?
That's so cool.
You just wiggle it. The trigeminal nerve is here. Open that up. She's got a little bit more prominence over here than over here. So see, I don't know if you can tell on camera, but this side is more swollen than this side.
Oh yeah, this one doesn't feel the same as the left side.
Yeah. And I think it's just because this side is open. Like we saw in the x-ray, it's tilted.
Mm-hmm.
So usually the open sides, they like to fill up with fluid and inflammation more readily than the other side. When I'm feeling this, I'm pushing fluid out. I'm just draining it out of her head. See, it's not here. Just kidding. Trigeminal nerve. So let's just get a good pull. And I like to wiggle it to kind of floss the nerve through as we go down to the ganglia.
Feels so interesting.
Just pull. That's it. There it goes. Okay. Ready. Awesome. Side. Very good. Nice. Nicely done. Very good.
It feels nice.
Yeah. All right. Toes. Reach overhead, grab the table. Good. Get some blood in there. Come on, ready. That's a rib. You were asking what that was? T1 rib. Look up for me. Let's smush it down. That's it. There you go.
It's an interesting feeling. It doesn't hurt, but it's like relaxing, but at the same time it's like, what is that?
It's right there. I'm going to get it. Okay, relax. Cross your arms for me. Yep, and lean forward a little bit. There we go. Okay, relax, relax. Whew. Let's do the right.
It sounds so cool.
You okay?
Yeah.
That's a big knot there. Phew. Okay. I'm just going to brush over her spine. You can look up. That hurts your neck, yeah. No. So the most inflamed one is right here, right off the bat.
I can feel it a little bit.
You can feel it a little,
Mhm.
yes. And breathe. Good. Over here. Just trying to free up that scapula. Done. Breathe. You got it. You did it. It's a rough one. I know, it's rough. Get that to loosen up. It's not easy.
That's so odd. I could feel it more in my arm.
Yeah, it's down into her arm. Look at that. It's not every day we get it like that.
Wow.
It might stop here. You know, it's getting less severe the lower we go. No, so it stops pretty much here.
I feel like I'm always stressed. I'm like, let me treat myself to a massage. They're not all good, but
Well, sometimes just being rubbed down is not a bad thing, you know. Nothing wrong with that. Just get her wrist. Just shake it and let the pieces forward in me. I'm just kidding. No, the scaphoid gets stuck. It's like a little boat That's why they call it the scaphoid probably. And I'm like shaking it this way to get it to come loose. Yeah, navicular is in the foot, and the scaphoid bone is in the wrist. Lunate, because it looks like a moon. They name it for what it looks like. It's not very scientific, is it? It looks like a moon. Let's call it the lunate. Like, okay. Makes it nice to memorize it, though, in school. And yeah, it looks like a moon.
If only everything would just be named after something that looks like...
It looks like a tongue. Let's call it the lingua. Literally. It's red. Let's call it the red nucleus. I mean, that really isn't like that. There you go. Oh, right. Oh, this side's clean. I don't feel anything over here. Okay. Deep breath in. All the way out. Again. Deep breath in. I know it's sore. And again. Okay. How far up does it go?
Is my skin cracking?
Yeah.
So interesting.
Yeah.
It's like I could feel, but I didn't know what was happening. I like it. It's so interesting.
Okay. Breathe. Get it. breathe. Deep breath in. Head goes back, let it go. Let it go. I got one side of it. There's one more. I don't know if she'll let me get it. There we go, other side. Yep. Away. Up there. Yep, that's it. Good.
It feels like I'm ready to take a
Take a nap. Okay. All right. Epsom salt bath and a lot of water.
Okay, a lot of water.
Yeah, you need to go through like 16 ounces right now.
Okay.
And flush that out. The more water you drink, the less sore you feel the next few days. Okay? What'd you think? Give this video a like. Subscribe. Subscribe.